Greetings, fellas. Roger Bowman here on behalf of MasculineWellness.com. And the topic of this video is going to revolve around testosterone replacement therapy, otherwise known as TRT, and doing it wrong and the consequences that can potentially come about if doing so. So often we confuse therapeutic TRT, testosterone replacement therapy, with bodybuilding type approaches and anabolic steroids and all that. There is a difference. And coming from a bodybuilding background, for those that may not know me or know much about me, I used to compete. I haven't in several years, but actually took it all the way to the top, won my IFB Pro card in men's physique. So I get all that. I love to have a good physique like the next guy. And I also understand that within the bodybuilding community, things are often taken to extremes. And I'm not here to judge. I get it. I always say, to each their own. But if we are looking at TRT from a longevity, therapeutic, an overall wellness standpoint, we need to separate the two worlds, if you will. So unfortunately, we have a lot of every regular day Joes that go into a TRT a program and they want to self-medicate, or they listen to way too much bro science, or they hear this piece of advice and this information and this input, and often these doses are extremely large in very just that, very extreme in every way, shape, and form. So there are a few things, and I'll just tackle testosterone. So normal levels for most men, that would be considered a very nice optimized number, and a very high end of a normal scale could be anywhere from 1,000 to 1,200 under total testosterone. And this is simply going based off LabCorp's values. Every laboratory is going to have their different lab tables and values that they're going to suggest and put out there. But to take something from say like 1,000 to 1,200, up double that, and in many cases even more, and then on top of that we're adding in anabolic compounds as well, we start to muck up the waters internally per se. So just looking at testosterone in and of itself, if our testosterone levels are extremely elevated, well above and beyond what our body sees as being normal, it most likely is going to drop your HDL, high density lipoproteins. That is your good cholesterol. It's going to lower that. That's one. Two, your odds of aromatization via aromatase enzyme and liver conversion, whatnot, that testosterone into estrogen is going to rise also. And if you are a man that is carrying around too much or excessive body fat, your odds of that aromatization or conversion in estrogen is higher yet. So that's another thing. And then guess what happens when we have extreme elevations in estrogen, because we're taking insane amounts of testosterone that really is no longer therapeutic. It's more, from a bodybuilding, let's go take it to the extreme that we can. Then we, in many cases, are going to look at an AI, which stands for aromatase inhibitor. These would be things such as anastrozole, Remedex, Aromasin. These are, aromatase suicide inhibitors. They essentially block the conversion of the testosterone into estrogen. They kind of interfere with that pathway, right? But if we start incorporating way too much of an AI, and a little bit in many cases is in fact needed, but I'm talking about extreme situations here. If there is an extreme amount, large amount of an AI incorporated, guess what? That's also going to lower HDL, which again is our good cholesterol. So now we're looking at our lipid panel and cholesterol, and our circulatory system is already starting to get a little dirty, right? Furthermore, if our testosterone levels are elevated, extremely elevated over a long period of time, that is going to contribute most likely in a lot of the cases, an increase in red blood cells and an increase in hematocrit hemoglobin, which in some cases it's not always a bad thing. I mean, if we think of people who live high up in the mountains, the altitude is way different than us down here at sea level, and the oxygen is less, those people have higher red blood cells and hemoglobin and all that. It's not so much of a bad thing. But when those levels are really high, that's technically referred to as what's called polycythemia. But what really becomes a danger is when we have a polycythemia condition, and then we also have what's called thrombocytosis, and that's where we have an increase in platelet counts. Now, if all this starts to occur, which in some cases it does, in layman's terms, our blood is becoming very, very thick, right? And when our blood is very thick, it becomes a lot. It's more work for the heart to pump that sludge around, that thick blood around. And that over time is going to start to stress the heart. It can potentially lead to hypertension, high blood pressure. And if we are to have elevations in high blood pressure, over time, that's going to affect our endothelial function, our arteries, and the circulatory system in short. And that can start to therefore have a negative impact on blood flow, sexual function, libido, and just the list starts going on. So you can kind of see where things start to kind of spiral out of control. And, if we take just a tiny little step back, in many cases, we have or see men that are on TRT programs, but yet they're still not really happy or doing very well in the libido or the erection department. All right, they have erectile dysfunction, and then they're incorporating Viagra or Cialis in addition to their testosterone. And oftentimes it's because these things I just mentioned have occurred over time, and that has happened because they've negligently went about their TRT program, or they've self-medicated, or they've supplemented outside things into their TRT program that maybe they should not have been doing. So these are some things to know about and to consider and to ask yourself, am I looking at this as a long-term wellness therapeutic approach so I could look good, I could feel my best and be healthy? Or am I looking at this because I'm doing a bodybuilding show and I want to look super shredded? And again, I don't judge. I've been there, done all that too. And in some cases, if you do something temporarily and then you're very smart as to your approach on how you do it and how you stop doing it, that could be fine. But in the vast majority of cases, I see men that have absolutely no clue what they're doing. They think they might have an idea because they've listened to 20 different people online, but they often end up damaging their endocrine systems and their HPTA axis systems, and it becomes a really tough road to travel to kind of get back to feeling looking good. And in some cases, unfortunately, they never do achieve that because they start going down all kinds of different paths trying to figure it all out, which in the journey of doing so end up damaging their bodies even more. So things to consider, nuggets to chew on. Hopefully they got your brain kind of thinking a little bit. For those of you that may have more questions pertaining to men's wellness, masculine wellness, TRT, and so much more, please let me know. Shoot me a question. And other than that, you can always click the subscribe button. Follow me on any social media platforms that I have listed on the masculinewellness.com website. But other than that, thank you so much, guys. And I will see you in the next video. Take care.